Welcome to Health Reform 2.0, the only place on the internet for people with a curious mind and a desire for a better healthcare system. Here we take you on a journey of our current quagmire, tell you where it came from and why the government can't fix it. Along the way, we'll tell you some history, bust a few big myths, tell you a few stories, and give you an idea how we can work together and get the healthcare system we want. Let's get started. All right, we're back again. We're like a bad penny. We keep turning up.
We are.
Today's episode is number 10, and we're going to be explaining an introduction to Medicare. We're going to tell you what Medicare is. We're going to talk to you a little bit about how it works. And that's basically what we're going to focus on in this episode. This episode may be delivered in a series of smaller episodes so that we don't get too bound up into detail, because you can pick up a topic on Medicare and we can talk for hours.
Sure.
But today's real focus is just to explain what Medicare is and where it came from, etc. So without further ado, let me welcome my partner, Tim Henning. And Tim, you've started to put together a lot of the things for this episode. Did you have a good time looking at what you're going to be needing here shortly?
This is really appropriate because starting May 10th, I'm officially retired.
Yep.
And I'll be doing COBRA for a while, but looking into all the ins and outs of this. And I hope it's a benefit for everyone that listens to the podcast, because I think we're going to give you some information that may be helpful for you at some point.
So you retired. Mm-hmm. Does that mean you were tired?
No, I wasn't tired at all.
Well, then
I was just fed up.
You can't retire if you weren't tired first, right?
Yeah. Well, I can go try to get tired of something else. It's been a crazy time. So this is a part of a series, and there should be about 5 episodes, and they may be broken up into smaller groups. We're going to explain Medicare, and then we're going to go into an episode that compares Medicare for all, universal health care, and single payer, which I think you'd get a kick out of. We'll talk about the politics of Medicare. We'll talk about a better way and some of the ins and outs and fallacies around Medicare. Because there's a lot of sound bites going on out there right now. We see this new election cycle ramping up, which I want people to be educated and be dubious of, because you're hearing a lot of sound bites. You're hearing a lot of information out there that's not necessarily accurate. And we're going to try to dispel some of that and explain the accuracy and what this all actually means.
You know, one of the things you learn, particularly when we go through and look at programs like Medicare, is you actually know how the system works. But then when someone tells you politically what it is, you don't think about it. You know, like Medicare for all, it's another version of the single payer system. No, it's not.
No, it's not. It's not even close.
It's not, exactly. And we'll talk about that in another episode. But, you know, you stop thinking when it comes to healthcare. You just stop thinking. You go to a doctor, your kid's got a cold, and the doctor says he's going to give him an antibiotic.
Yeah.
Right? Well, what's a cold? Cold comes from what kind of organism?
A virus.
A virus. And what does an antibiotic work on?
Bacteria.
And they're not the same organism, right?
No.
Okay, so it wouldn't, if they had an anti-anything, it would be an antiviral. So if you go to a doctor and he tells you got a viral infection, and then he says he's going to give you a antibiotic, you really should think about getting a different doctor.
Or you should just quit getting on his case for not giving it to you, because you just want a pill to take because you think it's going to be better.
Exactly.
Just go home, get some chicken soup, and you probably will be fine in 3 or 4 days. So what is Medicare, Tom?
Well, Medicare is a system that is part of the national United States health insurance programs for people 65 and older. It's also for certain people with disabilities or end-stage kidney failure. The program is divided into various parts, and how these parts fit together is really important to understand. Medicare is also a catch-all. We talked in the last episode about how Medicare has actually got programs to reimburse hospitals for the underserved care where they don't get paid. Hospitals, if they start to lose money there, they can apply through Medicare to get some additional reimbursement. There are lots and lots of pieces to Medicare that have, in some cases, nothing to do with the care you're actually getting delivered. But we have Medicare. It was created in 1964.
Yeah.
It was an extension of Social Security Act. There is no Medicare Act. It was part of Social Security. And like I say, it's been around for a long time. It has changed a lot. We'll talk, I think, in a segment of this about the history. It's changed a lot over the years.
Yeah.
Like I say, there's a number of parts to Medicare. And Tim, why don't you tell people about what Part A is, what it does?
Sure will. Before I do that, Tom, this is amazing because this is absolutely free, right?
Oh, of course it's free. It's the government's largesse, Tim, isn't it? Am I wrong?
Ladies and gentlemen, this is the biggest joke you'll ever hear when people talk about Medicare for all. We'll get that. That's fine with me. Do Medicare for all, but you're going to pay for it.
Exactly.
That's what it is. It's an insurance program.
Right. And I think we pay into Medicare, don't we?
I think every time I get a paycheck, there's a thing called FICA.
Yeah, FICA.
Yeah.
I'd love to tell you the acronym, but that would include the F word and a few others, so I probably shouldn't.
And guess what? They collect that money from the day you start working.
Oh, yeah, yeah.
And when do you collect it back?
Well, you got to get sick.
Or be 65.
Yeah, you got to be 65 and sick. You know.
Okay, guys, here we go. So Medicare Part A. Everyone thinks Medicare is all about is you get coverage at the age of 65, or if you have other conditions and so forth that we talked about. There are some caveats to that. And it's the cost for hospital care. And it takes care of your hospital care. It covers the cost for a semi-private room. It doesn't really cover the cost of any treatments you may incur. That falls under Medicare Part B, which Tom will explain.
Right.
So if you're in Medicare Part A, that covers, if you're into the hospital, it's going to care from, but it's not all of it. There's a deductible. Ever heard that word before? What's a deductible in a private PPO insurance company plan? It's a deductible.
It's a deductible.
It's the same thing
here.
here.
It's what you have to pay before they pick it up.
Right. You're going to pay out of pocket typically for this about $1,300 to $1,500 a year.
Right.
On the Department of Care Part A.
And what would an annual cost of premiums for a single person under the Affordable Care Act be, Tim?
So it depends. Right now, my wife's paying $585 a month.
Right.
My friends down the street are a couple. They're paying $1,500 a month.
A month. Yep.
For the affordable care on the covered California.
Right.
Right. And it varies. But if you're stuck in that quagmire where you make just enough money that you can't get a subsidy, this is what you're going to pay.
Right. Now, and you would think that Medicare is a deal because obviously Medicare is giving you the same level of treatment as those $1,500 and $2,000 programs.
Depends on the program.
It depends on the program, number one. And number two, it also depends on what Medicare has authorized the treatment to be.
Exactly.
Right. Or the drugs to be. And when you go to an insurance company, ladies and gentlemen, and you need a drug like Brilinta or something that costs a lot of money, your insurance company has figured out how to deal with that. And between the rebates and the insurance company and all the other things that are happening, usually those drugs end up on what's called a formulary. But the Medicare formulary is very restricted, and it's very much weighted to generics. And many of the newer drugs are not on the Medicare formulary. They're going to cost you extra. So while Medicare looks like it's a really good deal at $1,300 a month or so, it's not.
Exactly. So you want to go over Part B because this is where a lot of the cost comes in when you're seeking health care. And I'm not talking about going to the hospital here.
Right, right. So Medicare Part D is basically outpatient medical coverage. Part B covers essentially all of the other things you need to do outside of an inpatient hospital stay. Without Part B, you'd be uninsured for doctor's visits, like
Imaging.
we were back in the 50s and 60s,
Yeah.
including doctors that treat you in the hospital, by the way. They are getting paid under Part B. You also wouldn't get Medicare coverage for lab work, preventive services, and even surgeries. Most importantly, Part B is what covers cancer therapy and kidney disease. And as you age, cancer therapy and kidney disease become one of the dominant needs of treatment of the elderly in the U.S. They're extremely expensive items that would cost a fortune without having this supplemental Part B coverage. The cost of Part B is set by Social Security, and it changes from year to year. Individuals in higher income brackets pay more than those in lower income brackets, and how much you pay is determined by your adjusted gross income reported to the IRS in recent years. So it is a program that was designed to be fair and balanced across the number of people that are eligible for it based on income. It does try to balance it out. So if you have Part B, you also need Part C. So Tim, why don't you tell people what Part C is?
Yeah, this just goes on and on. So Part C is what is commonly referred to as Medicare Advantage. It's an insurance plan. It's an insurance program no different than you have today with you go to United PPO or whoever. It's the same thing. You must be enrolled in Part A and Part B to qualify for Part C. Once you're enrolled, your Medicare coverage will cover you an Advantage plan, but it has to be within your service area, and it's not a government insured program.
Right. It's private insurance that makes up the difference of what you're going to pay out of pocket for many of the things that Medicare doesn't cover, including your deductible.
And one more point back to Part B, that we talk all the time about people, and I'm just so sad that go into bankruptcy because they end up with late stage cancers. They have to mortgage the house. There's a certain cancer center that we're more than glad to take the mortgage on your house for your last 4 treatments of your, whatever you got. And this bankrupts people. We're going to get into this in a little bit because you have to pay for this, ladies and gentlemen. You have to buy a supplemental plan, which we're going to get into in a few minutes.
Do you know that there's a law, Tim, that says if you utilize your Medicare plan, in other words, you go deeper than what you've been paying into it, that the federal government has the right to seize your assets upon your death to make up the difference?
Yep. Death and taxes, buddy.
Yep. And Medicare.
And Medicare. And the IRS. And Affordable Care Act.
So what is Part C?
Well, Part C, again, is a Medicare Advantage. Right. And it really comes down to a private insurance plan that you buy to cover a multitude of things from A, B, C, and into Part D, which you're going to get into in a minute.
So then let's come up to what Medicare Part D is. Part D is the newest part of our national health insurance program for people age 65 and up. For half a century, there was no Medicare coverage for prescription medicines. In 2006, our federal government rolled out Part D. And like all the other rollouts of Medicare, it came out with high hopes, and the reality of what it does in the marketplace, what it actually is costing us in the marketplace, is nowhere near what they told us it was going to be. It covers retail prescription drugs that you pick up yourself at the pharmacy, or you can order via mail order. You choose a carrier and enroll in their drug plan, and that's how you sign up for Part D drug assistance. Most states have about 30 drug plans to choose from, and the best way to determine which one is the right fit for you is to have your agent run a Part D analysis using Medicare's prescription drug finder tool. Back to formulary. And do not be surprised to find that most of the latest therapies that are out there, both pharmaceutical therapies and biopharma therapies, are not going to be on anybody's formulary.
Exactly. And back to the previous episode where we did on drug prices, this is what happened when this got passed, is that we cut a deal with the devil. We cut a deal with the prescription drug manufacturers that we weren't going to negotiate the price of drugs that were fought by the federal government for Medicare, Medicaid, S-CHIP, all these programs. We're paying list price. We didn't use the buying power of this massive budget that we have for this. Instead, we're paying list price. Why? Because of rebates.
Exactly. So the way the rebates work, we explained before, is any drug bought through a federal program, including Medicare, Medicaid, VA, TRICARE, which is the active military coverage, all those drugs, and many state and local programs in mental health and HIV and AIDS and others. All the drugs that are bought and delivered through those programs, either through the federal government or through the state programs, is subject to mandatory federal rebates that get paid back to CMS, Center for Medicaid and Medicare Services. And then they pay those things forward, either in terms of putting them in their budget for the coming year, or for, in some cases like Ryan White, paying back to the states. So we've talked about this before. Those rebates range from the low of 17.5% to over 50%. And the average reimbursement rate back to these things is about 32 to 35%, depending upon the numbers you look at. So don't think that the numbers Medicare says they spend on medication is real.
It's not.
It's not.
One more point before we move on to the next case. Again, it came up to me again last night. I got so irritated when I was going through this. So those people that brought you the Affordable Care Act, those people that are bringing you on these programs, those Congress people you put in place, those professional politicians, those people that watched their net worth grow from the day that they became in office to the day they are today, sum up to almost 250% or something. Guess what? They didn't have to take the Affordable Care Act. They didn't have to go and get that same insurance. Guess what? They exempted themselves. They got covered by TRICARE.
Right.
And yet, whatever they thought was going to make you better, they took something else. Why do you think that is? Why can the people that make and force you to do something get a pass and do something else that benefits them?
Well, they do that in everything now. They get lifetime pensions. Very few people still get those or ever got them.
They're crooked.
We talked about in an earlier episode. You become a member of Congress, and it's your ticket for the rest of your life.
Yeah.
And we need to ask a fundamental question: should it be? Because it does affect everything, and it really does affect what's going on in healthcare.
We're going to get into that in closing.
So let's close this up and talk a little bit about the history of Medicare and Medicaid and Lyndon Johnson's Great Society program. Johnson signed the Social Security Amendment into law in 1965. The law established Medicare and Medicaid programs that were designed to deliver health care benefits to the elderly and the poor. Medicare was initially designed to provide health care benefits for people 65 and older and their dependents, regardless of income or medical history. The Social Security Amendment of 1972 expanded the program to include individuals under age 65 with permanent disabilities and people suffering from end-stage renal disease. In 2001, eligibility was again extended further to cover people with Lou Gehrig's disease.
Right.
Now, we're going to close this episode by giving you a clip and letting you hear a clip of a conversation between Lyndon Johnson, Wilbur Mills, and Carl Albert when Medicare passed, so that you can hear in your own words why they focused on bringing you the extension of Social Security and creating Medicare and Medicaid. Speaker of the House John McCormick calls Lyndon Johnson.
Hello. Yes, Mr. Speaker. They told me that you and Carl wanted to talk to me. Yeah, we got Wilbur Mills here with Wilbur Cohen. Well, here's Wilbur. You want to talk with Wilbur Mills? All right. Wait a minute, Mr.
Wilbur Mills, chairman of the Ways and Means Committee, reports to President Johnson.
Mr. President. Hi, Wilbur. How you feeling? Fine. Good to hear from you. We wound up, and I got instructions. We'll introduce the bill at noon tomorrow and report it at 12:15. Be very briefly doing so. I wanted to let Wilbur Coyne, if you would take a minute, to give you his reaction to it. Fine. I think we've got you something that we won't only run on in 66, but we'll run on from hereafter. Wonderful. Thank you, Wilbur. Now, here's Wilbur.
It didn't have anything to do with bringing care to people. It had everything to do with winning elections, as Wilbur Mills says, this year, next year, and for many, many, many years into the future.
Mr. President, we will give you something that we can run on for decades. And they did.
We hope you enjoyed this episode. We'll see you again very soon. You've been listening to Health Reform 2.0 with your hosts Tom Locher and Tim Henning. We hope you found the topics interesting, that we answered a few questions, that you laughed a bit and were entertained. Please feel free to invite your friends to join the discussion, and remember, hit that like button and don't forget to subscribe. Send us your questions to info@hr-20.com. We hope to see you again next time.